Show. My name is Purity Museo, and today our topic of discussion is cerebral palsy. Dr. Edward Sang will be helping us understand what this condition is, and later on, in a short while, we will be joined by Susan Njeri, who is a mother with a child with cerebral palsy. Call us live. The number is displayed right at the bottom of your screen. Use the hashtag MyDoctor on Twitter at EbruTV Kenya or at Purity_Museo. We will be glad to respond to some of your concerns. Welcome to my Doctor Show, Doc.
Thank you.
Yeah, thank you so much for making time for us. Yes, let's start with defining what cerebral palsy really is.
Well, it's a condition which is usually diagnosed in childhood, either in infancy or the preschool years, where the child is noted to have some abnormalities, especially with movement, with the posture or the muscle tone. And so usually the milestones may be delayed, where you expect the child to have sat or stood or walked at a certain age, there's a delay. And so there may also be delay in talking and various other factors. So it's usually it's actually from a brain lesion. There's a problem with the brain, and this problem usually starts before the birth of the child. But then the effects are seen after the birth, and usually in the first 1 year of life.
So the brain, it's all about the brain development, that's what you're saying, and it starts when the baby is still at the womb during pregnancy. So Doc, maybe you could just take us through what is the cause of cerebral palsy? What's the cause of delayed brain development?
Well, most of the time it's a problem with the mother. Various infections can be a problem, like German measles or rubella, infections like toxoplasmosis, like cytomegalovirus, like syphilis even, chickenpox in the mother. If the mother gets these infections during the pregnancy, they can go through to affect the baby in the womb and then affect the brain. And so if that occurs, then the baby will get, in some cases, get cerebral palsy.
Right.
Others can actually occur in the baby itself after delivery, like meningitis, if the baby gets meningitis, encephalitis, severe jaundice can also be a problem, or even head injury. A baby falling can damage the brain and then now gets cerebral palsy.
Right. And let's begin with before the baby is born, and you said maybe you could just talk a little more on the risk factors before the baby is born, you know, to the mother. What are the risk factors to having a child with cerebral palsy?
Most of the time it's maybe poor antenatal care, having certain infections which are not taken care of, things like chickenpox, the rubella. In certain countries, these are tested for in early pregnancy. So if the mother is exposed, then she's vaccinated.
Right.
So good antenatal care is important, keeping yourself healthy, getting pregnant when a lady is healthy so that she's not at risk for these infections.
Right.
And if they're there, they're treated.
Maybe you could also highlight some of the risk factors for a baby. Once the baby is born, you've also mentioned that there is chances of that baby getting cerebral palsy. What are the predisposing factors to that?
Well, even the birth itself, though this is not as serious or a common a cause as it was previously thought. Because in the past, most people would think that it was just the birth process that was a problem, a difficult delivery. But it has been found that that plays a very small role in causing cerebral palsy. But once the child is born, they can get meningitis. Some get jaundice, which is the yellowness of the eyes. So again, if a baby is found to be jaundiced, they are usually treated by the pediatrician. Sometimes they need phototherapy, because if that is not treated, the pigment can affect the brain and then also predisposed to cerebral palsy.
Yeah, and just in case you're joining us for the very first time, you're right on time for My Doctor Show. Our topic of discussion today is cerebral palsy, a condition that makes a child unable to walk or even talk. And in studio, we do have Dr. Edward Sang to just help us with that discussion. We'll also be joined by Susan Njeri, a mother with a child with that condition, to just help us understand how it is like to manage such a condition, a child with such a problem. Talk to us, call us live. The number is displayed on your screen. Use the hashtag #MyDoctor at Ebru TV Kenya at Purity_Museo. And Doc, just before we get to factors after birth, let's still stay with the factors before birth. Is there a way you could tell, maybe through the scanning or when you go to the antenatal care, that there are chances of giving birth to a child with this condition? Is there a way you can tell before birth?
Not so easily, because an ultrasound may not really show it may not be a physical problem that is easy to see on ultrasound. So unfortunately, everything may look okay, and the symptoms actually will develop later on in the first 1 year of life. So that you may not really be able to tell before delivery.
Right. And also the symptoms, they can only express themselves after birth,
yes.
not before birth,
yes.
right? So let's get to the symptoms for cerebral palsy. How do you tell once you've given birth to your child in a few days, a few weeks, or a few months that your child has a problem? You know, there's difference in your child.
One of the things which can occur is epilepsy, which are convulsions. So the mother may notice the child is convulsing or having abnormal repetitive movements of one limb. Things like not swallowing well. You feed the child and the child has problems swallowing food. The child may not be seeing well. So as they grow older, the eyes are not focusing on the same object. And then later, the limbs may be too stiff or too floppy, too weak, and then the delayed milestones. So when you expect the child at maybe 6 months to 8 months to be sitting, they are not sitting.
Right.
Or when they're expected to stand, they can't stand. And so these may be something that may now make the mother to take the child to hospital.
And Doc, just staying with that, some of the symptoms that you highlighted, do we have associate disorders to cerebral palsy? Because for a child who is still young, it's a little bit difficult to tell. Do we have some associate disorders with cerebral palsy?
Well, usually, if you see the abnormal movements, abnormal posture, because if the child is having abnormal movements, the abnormal positions, abnormal movements of the hands, then those may point you in that direction. And these may occur later on. They may not be apparent at birth, but as the child now develops, then you might realize that there's some delay.
Okay, and before we get to the effects that the cerebral palsy can have on a child, maybe Doc, you could tell us what exactly happens, because it's all about the development of the brain, the delay of the development. What exactly happens, the coordination, you know? Yeah.
Well, the brain controls every aspect of our movements, of our lives, actually. And so if there's a part of the brain that is affected, then that may cause a problem. So the main issue is the brain. And that problem actually usually stays the same throughout the life of the child. So it doesn't get worse, but only that these movements may be apparent as the child gets older. Again, there's a very wide range. Some of the children may be able to go to school, they may even be able to walk and maybe have just one hand not okay, while others may have problems walking.
Right. And maybe, Doc, you could just stay with that. Maybe you could just stay with that, exactly what happens, especially now when the brain has not been developed well. What can this child and what can't this child do?
Oh, it's a wide range. It's a very wide range. So some of them may not be able to walk. Some may have mental deficiencies. They may not be able to go to school. Others may be able to. So it's a very wide range. So it depends from one child to another.
Yeah.
Even urine incontinence may be an issue in some of them. They can't hold urine because of the control from the brain is not adequate.
Right. Okay. And remember, today our topic of discussion is cerebral palsy. To just understand what this condition is, but what we know is that it helps or it makes a child unable to talk or even walk. In studio, we do have Dr. Edward Sang, who is helping us with that discussion. And also joining me is the beautiful Susan Njeri with her child who has the problem. And we'll just be learning more about cerebral palsy. Welcome, Susan.
Thanks.
Yes, and welcome, Mom. Welcome. You're so pretty. So, Susan, welcome to the show. This is my doctor show. We're talking about cerebral palsy, and thank you so much for making time for us. We had earlier on talked about what the condition is and also some of the symptoms and what could be the cause for that. Maybe, Susan, we could start with you to just help us understand, when did you realize that, you know, my child is different from other children?
When I gave birth to Princess, immediately when I gave birth, she had a nuchal cord. She had a cord around the neck, and it had tied twice. So I thought maybe it was okay when the doctor told me not to continue pushing, and then when the procedure was over, I did not realize at that point. But after 3 days, she developed severe jaundice, and she was admitted and taken for phototherapy and transfusion exchange. And from there, after admission of 2 weeks, went back home. I did not realize anything, but until 4 months, when I realized my child did not have head control like any other child, and how I would expect the growth of the child to be. And that is when we decided to seek some medical attention, where we went to a neurologist and were advised to start physiotherapy, occupational therapy.
Yeah, and Susan, maybe what exactly did the doctor say was the problem? Was it before your child had been born, or it was after the child was born?
It was after the child was born, because I was told the severe jaundice is what caused the brain damage. Yeah.
Yeah, and Doc, for Susan, it's different. It's after the child was born. Maybe you could tell us what is the reason behind jaundice? What causes that?
Yeah, jaundice actually does occur quite frequently. The commonest cause is just what is called breast milk jaundice, meaning that the baby's system is not yet able to digest the milk very well, and so can get a bit of jaundice, usually about 3 days after delivery. And usually some blood tests are done to check the levels of bilirubin, which is the yellow pigment, and to see if they need phototherapy. If the levels are not too high, they don't need phototherapy. If they're high, then they go for phototherapy, which is the child is put in under a blue light. So they use the long tube light and cover it with a blue paper, and then that blue light actually does help clear the jaundice. Another cause is blood group incompatibility, meaning either the rhesus, meaning the baby may be rhesus positive and the mother is rhesus negative, or the mother and the baby may have different ABO blood group, meaning the mother may be A, blood group A, the baby is blood group B. So that interaction, because the mother and the baby's blood, they mix.
Yeah.
So if they are different, it can make the baby's blood cells to break up and form the jaundice.
And Doc, maybe we can receive one call. There's someone who has a concern. Maybe you can hear what Eric has to say. Hello, Eric.
Hello, my name is Eric.
Okay.
Yes, I have this question. My wife is pregnant.
All right.
And sometimes she doesn't feed well. That is like she doesn't want to eat properly. So I'm worried about the issues of nutrition. I wonder whether this one can affect the child to develop cerebral palsy or not.
Okay. Thank you so much, Eric. All right. We could answer him before you forget. Nutrition and cerebral palsy.
Well, not a very strong, actually there's no relationship usually, because eating during pregnancy can be a big problem, especially in the first few months, where the lady may even have morning sickness and vomit a lot. But usually after about 16 weeks, then that usually settles, and then the appetite comes back. So that usually is not a cause of alarm, and usually the appetite does come back and has no relationship with cerebral palsy.
All right. And Susan, I'll just get back to you. Once your child, when actually was your child diagnosed with cerebral palsy? Was it maybe how many months or weeks or years after birth?
It was at 6 months.
Yeah.
That is when the occupational therapist actually told me that my child has cerebral palsy. And when I went back to the neurologist, he confirmed the same. But I did not continue with the neurological follow-up, because the doctor told me that she might not need neurological attention. That is because she was not having any convulsions on. So the only person who was in charge could be an occupational therapist.
Right.
Yeah.
And Susan, what are some of the symptoms? The doctor had already talked about the symptoms for cerebral palsy. What could you see unusual with your baby at that particular point?
One was the lack of head control. And again, she could not, say like small babies have a tendency of maybe biting their fingers and all. She could not do that. She was very unstable, especially when dressing her up. She was really unstable. And also the muscle tone was quite high, and she could not stretch, and the reflex was very low. So those are some of the things that I observed during that time. And that is what actually up to now we are still battling with.
Yeah. And Doc, can we now get to the treatment? Yeah. Is there a way we can treat cerebral palsy, or is it a permanent condition?
Well, usually the lesion in the brain usually stays the same. It doesn't worsen. But occupational therapy is needed to prevent a worsening of the movements or the stiffness, and to improve posture, things like that. So the occupational therapy is very important so that the child doesn't worsen as far as the movements and the posture are concerned. Yeah.
All right. And Susan, your child was diagnosed with cerebral palsy at 6 months. First, I'll just ask you a question as a parent. You know, what was your reaction like? Like, how did you feel? First, did you even know what cerebral palsy is? And if yes, what was your reaction like?
Well, it was somehow I knew about cerebral palsy. I came to know about it when we were admitted, and I had the doctor kept on mentioning about cerebral palsy, about some terminologies, connectors and all, and I just Googled and tried to see what this could be. But I was in denial. I was thinking in denial because I did not expect the images I was seeing on Google, on internet and everywhere else, that my child would turn out to be that way. I looked at her, matched the photos, and I was like, no, she can't be like this. It took some time to accept. Not exact time that I would say, I don't have an exact time I would say I accepted, but I knew all it was a long journey. That is what I saw through what I read through. And I did not have that time to even come to a point of feeling like I don't like this child, but I just felt it's a long journey, which I did not know the destination.
Right.
Yeah.
And how old is your baby now? What's actually her name?
My baby is 8. She'll be turning 8 years. She's Princess Gadoni.
Oh.
She'll be turning 8 years in July. Yeah, and she's coming up.
She's coming up.
Yeah.
Maybe, Susan, you could also maybe tell us some of the, we already talked about the symptoms, maybe some of the things that your child, you know, cannot do at with the age of others, comparing with her age mates. What are some of the things that maybe you can say she really is not able to perform?
Other than cerebral palsy, Princess has a profound hearing impairment, and so speech is just something that has not come forth. And it's now she also cannot feed herself because of the poor coordination and the muscle tone too. She can crawl, at least she can pull herself, she can sit up. Now we're still doing, we're in the next step of walking, standing, yeah.
Okay, and Doc, falling back to the symptoms for cerebral palsy for a child, do they continue till the child has grown up, or is it a delayed coordination? Is there a time that this child will pick up just like any other person, or what would you tell of that?
Well, each individual is different, and others, the degree of disability is different. So some may have very little disability, others may have a little more. So like with Princess, there's hearing problem, some have speech problem, some have problems of control of the urine, others have convulsions, others have mental deficiencies. So each person is different. And usually it's more of occupational therapy to try and help with each of the different problems that are there. So they may, and also with different specialists. There may be specialists to help with the hearing, others to help with the movements. If they have convulsions, there are people who will help to prevent convulsions, because again, convulsions worsen the brain problems. And so each person the treatment is individualized, and depending on the degree of disability. Yeah.
All right, and Susan, maybe we can a little bit chat about communication, how you're able to communicate with your child. I don't know, maybe you could just tell us how, because you said that some of the symptoms are clearly shown to her. Maybe how do you communicate with her? Maybe when you speak with her, she understands of how special do you do it?
Let me say with children with cerebral palsy, you just have to derive a communication, because at one point you'll need to get along. So for Princess, because we've stayed with her for long, we know the training that we've given her. Like we use, most of the times we use pointers. We can use photos like pictorial, and then we have the lip reading. She would understand some of the instructions. If I tell her, push this way, she'll go to that direction. If I ask her, what do you want? Maybe she can point at a photo and tell me maybe a potty. And those are some of the things that we do. And lip reading, Lala, she understands that.
Okay.
Because it's a continuous thing that she has done all through.
Yeah, and when we come back, we'll have that mom-princess talk, you know. Yeah, it's time for us to take a very quick breather, but remember, my doctor show continues. When we come back, we will be looking at managing, treating, and also preventing cerebral palsy. Call us live. The number is displayed right at the bottom of your screen. Use the hashtag #MyDoctor to talk to us at EbruTV Kenya, at Purity_Museo. Do stay with us. We are coming back in a short while. Welcome to the second and the last part of my doctor show. Remember, this is the opportunity you have to call us live. The number is displayed right at the bottom of your screen. You can also use the hashtag #MyDoctor at EbruTV Kenya, at Purity_Museo. Our topic of discussion is cerebral palsy. In studio, we do have Dr. Edward Sang to just help us with that discussion. We also have Susan Jerry with a beautiful princess who has cerebral palsy. We're just understanding what this condition is and how to manage it. But just before we get deeper into that discussion, home remedies first. Welcome back to our discussion. Today we're talking matter cerebral palsy. We do have a team of experts, or important team here. Next to me is Princess. Yeah, she's Princess, right? And next to her is her mom, Susan Jerry, and then we have Dr. Edward Sang. We're talking matter cerebral palsy, and we did promise that when we come back, we will have that mother princess talk, you know.
Sure.
Yeah, just tell us, she's already my friend, by the way, we're really connecting so well. So how are you able to communicate with Princess, you know? Maybe you can just show us a little bit.
Princess, say hi. High five. Yes.
She
high
doesn't
five.
Want.
Yeah, she's
You want
doing it. Her coordination is a bit low,
Okay.
but she knows I'm there for her. High five.
Mm-hmm.
And sometimes she can even tell me what she wants, but right here she doesn't see a switch to point at.
Yeah.
And she knows. You say hi to her?
Say hi to me. We are friends? Yeah, thank you so much. And Mom, how are you also able to, for example, when she needs something, she says it, or you say that she points at it, or what exactly does she do?
Yeah, sometimes she can even crawl to where she wants to go. Mm-hmm. Like if she wants that cup, wherever it is, she'll go there. Mm-hmm. Yeah, if, or else sometimes would cry until you understand. If you give her this, she has a taste of choice. If you give her the shoes that she doesn't want, she'll just kick them out.
Yeah.
If you give her water and she wanted food, she'll just discard whatever you give her until you get it right. Mm-hmm. So sometimes it's a lot of guesswork. Yeah, as much as we have derived a communication, but sometimes you have to guess because she's nonverbal.
Yeah.
Yeah.
And Doc, let's talk about managing children with cerebral palsy. What's your advice to parents out there? You know, do you need to go to a school to learn how to communicate with your child, or what happens for parents with such children?
Yeah, I think occupational therapy is very important, and as we had said, multidisciplinary management, meaning doctors and specialists of different types to handle various parts of the treatment. But occupational therapy is by far the most important, because it helps the individual to cope with the surroundings and to be able to live at home and within those surroundings. So also that the family can change the environment to help the individual do better. Also things like physiotherapy to make sure the muscles don't get too stiff, and the ones which are weak to be strengthened, to help with walking or movement, to help with hearing. You may need special hearing devices, to help with speech and coordination, so that with repeated physiotherapy and exercises, then the child can cope better and do better.
Yeah, and earlier on you had talked about jaundice being the cause for cerebral palsy. Is there a way we can prevent, or you talked about some of the factors that contribute or may lead to a child developing jaundice, but is there a way, once managed early, we can prevent such cases from occurring?
Yeah, because jaundice is actually very common, and it's usually noted before the child goes home while still in the hospital, and then treatment is instituted. There are various simple blood tests which can tell us the level of jaundice and whether sunlight, because sunlight also treats mild jaundice, whether that would be enough, or phototherapy, where the child has to be and in the baby cot with the blue light to help clear the jaundice.
Mm-hmm. Susan, let's talk about the stigma. You know, this was your first child, that's what you told me. How did your close family members, your friends, receive such news, you know? What did they say? We are in an African setting, we all know what people may think about all this. But what was your situation like? Was it different?
I cannot ignore the murmurs that could be going on, especially when it is not a direct question. Like if a person asks you, have your child sat? Is she walking? You know, that one already, it's a message. You've been sent a message. And you feel like these people are taking it from another angle, because the next question would be, why doesn't you take your child for sunlight? You know, it's a blame that is set on you as a mother, and somehow setting goals of failure because they feel that you've not done enough. And that is where you feel stigmatized, because you don't want, again, to have such a discussion with anybody about your child. So it might not come outrightly like you're not doing it, you're a bad mother, but you will be made to feel it. Yeah, but I always say to any parent, you're doing a great job.
Yeah, and is your child in school right now? Is there stigma for your child, you know, with other friends when they are when they are with other, or she's with other friends? Is there a little bit of discrimination on her part?
Let me say, for children love each other, and they will always stay, not because they're stigmatizing, but because they don't understand why our friend is not doing what we are doing. With children, I don't take any blame. But there's a lot of, I wouldn't call it discrimination, but it's like orphaning the cerebral palsy, because when it comes to schooling, being that each cerebral palsy condition is different from the other, it has been difficult to set up institutions for children with cerebral palsy. There are very few schools that deal with cerebral palsy. Either the ones that are there are not well capacitated to take care of them. So we feel like it's orphaned. My child is not in school because sometimes when you see about even the hearing impairment and the incoordination, you just feel that she needs customized education to get aware of her own environment. Because after all, when she gets to a certain age, even when she goes to school after 15 years, well, it's hard for a parent to accept that my child will, even in adulthood, would possibly be with me forever. But again, it's a fact you have to face. When you're faced with this condition, you have to face it and see the future of it. It will be less torturous to you as a parent, because you will understand that even after 15 years, 18 years, when this child gets out of school, you'll still have to come and orientate that child to your environment. So for me, I take it differently. As the doctor has said, there are some who can go to school, there are some who can't. For those who can't, I always encourage other parents to get them oriented to their own environment and derive a communication. Because in future, you don't want to be a stranger to your own child. You don't want your child to feel lost in their own house. They don't know where a toilet is. They don't know how to ask for this and that. So I think, to me, I take it differently with her and see that as much as I want her to go to school, the system is not the same as the other siblings who are already in school. So I just accept that I have to customize her own education.
And we'll be getting back to you to see what you think as a parent of such a child should be done, you know, for a country with, maybe Doc, you could just tell us from your own perspective, what are the numbers like? You know, is it a common case, cerebral palsy, in the country right now, or what would you tell?
Yeah, it's quite common. And as Susan has said, that at times the institutions are not enough or well designed enough for each and every child. And so, and also it depends on the degree of disability. So I think as a country, it's just to try and help these mothers and these families to be able to do some of the occupational therapy, to have places where they can do that, rather, because most of the time the parents would have to do it on their own without much help. Also, to counseling, getting them to go through it. As she said, there might be difficulties even in associating with friends and the extended family, being blamed for something you had no hand in. And so I think there's a lot that the community and the country and the government can do to help these children.
Yeah, and Doc, what do we expect for a child with cerebral palsy in adulthood, you know? Do we expect, is it the same way when she's a child or a young child? What do we expect? What are the symptoms like for when someone is an adult? Because we do expect so much changes, you know, body changes for a girl and also for a boy. What are the symptoms for an adult person with cerebral palsy?
Yeah, some may get a little better, but others will basically be around a bit like the same. And I'm sure even in some of our communities, some in the rural areas, you'll find some of them being left to fend for themselves. They're in town, they're ostracized. So the family support is really important, such that you don't expose this person to a lot of ridicule and even abuse and injuries or beatings, because they may not really be in control of what they're doing. Some may be mentally deficient, and so they need a lot of support.
Yeah, and once a child has cerebral palsy, is there a treatment for it, or the only thing that you can do for that child is just therapy? Is it a permanent condition?
Yeah, because the brain lesion doesn't change.
Okay.
It doesn't get worse, but it's permanent.
Okay.
And so the main thing is to control the posture, the movements, and mainly the occupational therapy.
Mm-hmm.
Yeah.
Okay, and for you, Susan, I know your child is not in school, but she likes smiling. What do you feel like as a mom when you see her smile, you know? It feels good?
We appreciate each and every little thing that these children do. Like if they know how to smile, that's a plus for us. If she just knows how, just lift a finger, it's a plus for us. It gives a lot of hope. And let me say, cerebral palsy is one condition that has given me hope, because I see children improving, and you know, obviously there's a future. It's not a disease, so it's just a condition that can improve in time. And more when I see the parents accepting these children, and I tell them to appreciate just the little they have done. Yeah.
And let's get now to the gap. You had earlier on mentioned that there are no enough facilitation for these children. I would also request you to maybe help us understand, as a mom, where do you think is a gap? What do you think should be done? But before you answer that, let's pick one call. Yeah. Sure. Okay, we have Violet online. Hello, Violet. Hello, hi.
Hi, I have a question.
Okay, Violet.
Nauliza hivi. Niko na mtoto.
Yeah.
Akona cerebral palsy.
Okay.
Na nimesikia wakisema kwamba the blood group ya mom na mtoto inaweza cause the jaundice. So my question is, my firstborn akona EP and I'm pregnant. So I expect to pata vingine of such a condition.
Okay. The doc is going to answer that question for you right now. Yeah, there's a fear, you know, and she will also be answering because she has other children. But before that, doc, just tell us, she has a child and maybe it was when the child was in the womb. So she's in fear. Is she expecting to get another child with the same condition?
No, not at all. And so with good antenatal care, they can go and see if there's any problem that could have contributed to the first one, and then the delivery will be taken care of well. And as Susan has told us that she has 3 other children after Princess who are okay, I think that should give her hope that there should be no problem. Yeah.
And Doc, maybe you could also let us understand, is this condition in any way genetical? Yeah.
In some situations, that there might be some mutations in some genes, but that again is a small percentage, where actually there's a gene mutation, meaning the genes are not okay, and so the child is born with some gene problems. But that is a small percentage.
Right. Susan, tell us how many children you have after Princess, so that at least that mom may stop getting worried of getting another child with cerebral palsy.
Well, I'm a mother of 4. I have Princess,
She's the firstborn?
She's the firstborn.
All right.
And then there is Prince, there is Parsley, there is Presley. All those others are boys. And apparently all the other, they've also had jaundice after birth. But the case with her
and
was
Susan,
different.
before you continue, because I know we really need to get the story, can we get one call?
Sure.
Then we continue. All right. Let's hear from Francis. Hello, Francis.
After birth. But the case with her.
Hello.
Hello,
Hi, how are you today?
I'm doing fine.
Yeah, go ahead with your question.
I was just wondering, my child he's called Nimrod.
Okay.
He's suffering from the same disease, cerebral palsy.
All right.
Let me say from now, he has to move his head and
Just reduce the
legs and the hands.
just reduce the volume of your TV, then we'll get to hear you clearly. Yeah?
Okay.
Okay. Go ahead. Go ahead now.
Now I'm saying my son is called Nimrod,
Okay.
and he was suffering from the same thing.
Okay.
I was just wondering, is it curable?
Okay. Let's get to hear from the doctor. Thank you so much. Maybe you could repeat whether it's curable.
So, what I was saying is that it may not be cured that the child will become normal completely, but there's occupational therapy to help with various aspects of the condition. And it also depends on the severity, such that some may have only one limb, one hand, which has a problem, but others may have mental deficiency, and so those may be, therefore, may be permanent. There may be hearing problems which can be helped, speech problems which can be helped, but it may not be able to clear completely to say that the child has become completely normal.
Yeah. And Doc, which is the best expert to go to, because you also had a problem? We do not know whether you're supposed to go to a neurologist because it's a brain condition, or you're supposed to go to a gynecologist because it's a birth-related defect. Who are you supposed to go and see?
Yeah. It's a multidisciplinary condition, meaning specialists of different types. You will need the occupational therapist, the speech therapist, somebody to ENT, surgeon for hearing. You may need a neurologist if the child has convulsions. So quite a number of specialists, and usually they would direct you accordingly. As Susan was also seeing a neurologist and later said, since your child doesn't have convulsions, you can continue with the occupational therapist.
Yeah.
So generally it's a big group of doctors who take care.
Susan, let's get back to you before we cut you short. You are explaining on the gap where you feel there is a gap, especially in the country, managing the children with cerebral palsy.
As I had indicated earlier, cerebral palsy is an orphaned condition where it has not been given the right attention and intervention. When we talk about the gap from the government, maybe because every other citizen would run for government So if it is like institutions, that is educational institutions and health institutions, sometimes we feel they're inadequate. There's also less awareness. It is not given the enough airtime that it's supposed to have, and so many people don't even know. That is why we have superstitions guarding the society, and saying all the things like curses and maybe blames, the stigma. It's because we lack awareness. Yes, we do it. We do awareness. Like for me, I do awareness for cerebral palsy a lot. But again, we need that backup. If the government really installs the institutions and gives us the attention that we need, if it is for the hospitals, we need maybe the medications in a reduced price or even free, because some of these children end up some of them die because they lack even the medications because of the convulsions that some of them are suffering from. So the medication, I think that is something that should be considered.
Yeah, and Susan, for you, I know you do take your child for occupational therapy. What's the cost treatment like for you alone?
Occupational therapy has become very pricey because most of the institutions are maybe privatized, but the private one, the public ones, they are too full. And maybe sometimes you may feel my child is not given the enough time or enough attention that she needs for occupational therapy.
Yeah.
So most of the parents would prefer when they have a therapist coming home, which it will come to another cost because it is not that manageable.
Yeah. And let's hear from Winnie. Hello, Winnie.
Hello.
Hello, Winnie.
Hello.
Hi, how are you today?
I'm fine.
Okay, go ahead with your question.
What do I do to control my son's head? He does not control his head. Hello.
Yes, I can hear you, Winnie. Go ahead.
I'm fine. I was asking, what do I do to control my son's head?
Yeah, okay. Thank you so much. She's asking what she's supposed to do to control her son's head. Yeah, I think the child has the same problem.
Okay.
Yeah.
I think more would be with occupational therapy. They would be able to advise and design something that would help. But I think that is more geared to occupational therapy.
Yeah. And once again, Doc, just highlight the symptoms for cerebral palsy for the last time.
Okay.
Yeah.
Well, there are a number of them. Usually it's to do with the muscle tone, the posture, and the movements. So there may be abnormal movements. There may be epilepsy. There may be issues of swallowing, hearing problems, speech, inability to walk or walking with limps, excessive reflexes or reduced reflexes, so the hands or the legs are jerking and out of control. There may be urine incontinence. There may be mental deficiencies. Epilepsy can occur. So quite a number of symptoms.
And because it's a brain development disorder, now for Princess, is it okay if, for example, we say this is the side that is affected because she's trying to lean on this other side? Is that correct, Doc?
Yeah, so what happens usually is that they may be use one side more, and as Princess is looking more on the right, and Susan, her mom, was telling us that the right side is stronger, so that's where she looks at more, while the left side is a bit weaker.
Yeah, so means that the brain development on the left side was a little bit delayed.
Well, at times it's not always like that, because at times usually the left side of the brain controls the right side. So it may not be that specific that where is the brain lesion. So, but there are tests which can tell us where the lesion is and the size.
Yeah, and Doc, also, is there a difference depending on the part of the brain that is affected? Because you just say the left side is more active than the right. For example, if it's the left side, the right side that is affected, is there a difference in terms of the symptoms that child is expressing?
It depends on which part of the brain, because there'll be the brain for the hearing, the parts for the movements, the part for swallowing. So depending on where the lesion is, the brain lesion, then that would affect the various functions. And so that will the location will determine the kind of symptoms the patient will have.
Yeah, and Susan, maybe you could also help us also understand there was something that you're supposed to respond to one of our callers. They wanted to know how to manage the neck of their children. Maybe you could also tell us, is there a little of pain, especially the fact that she has to lean on the same side? Do you maybe get signals from her that she is maybe sometimes in pain, or how do you regulate her head?
Well, for her head control, it also took time. She got her head control at around 4 years.
Yeah.
So it calls for too much patience. And also positioning. Occupational is all through about positioning. So even giving that child, there's a point where you have to give your child enough support for that neck. But there's a point where if that child has achieved at least 50% of the neck support, you can just let the child strain a bit so that they can strengthen, they can exercise their muscles. So it helps a lot.
Hear from Regina. I can cut you short a little more, but I continue with you when we come back. Let's hear from Regina. Hello, Regina.
Hello.
Hello, hi.
Hi.
Okay, go ahead.
I'd like to know more about cortical blindness. My baby has cerebral palsy.
Okay.
Hello.
Yes, I can hear you, Regina. Go ahead. We can get you clearly.
All right. My baby has cerebral palsy.
Okay. Just reduce the volume of your TV. For us, we can hear you.
She has cortical blindness.
Okay.
Yes.
Regina, just reduce the volume of your TV, then you can get to hear us clearly. All right. We've lost her, but she clearly said that the kid has blindness. Maybe she's concerned, is it another symptom for cerebral palsy, and how can she manage that?
Yeah, so she mentioned cortical blindness, meaning that maybe the blindness is actually, again, at the brain site for vision. And that is another symptom, actually, where the lesion may be affecting the brain, the site for vision. If it's at the cortical site, that may be difficult to cause the child to see again. But so they may now need, again, occupational therapy for blindness, where they can be helped to do braille if they are able to understand it, to walk with a cane, or in other countries where they have dogs to help with to move around, which is something we don't really have here in Kenya. But those are the options.
Yeah, and Doc, if I got you clearly, once there is a brain development issue with a child, basically is it is there a possibility that some of the senses, human senses that we have, they are the targets, right? They will be affected, right?
Exactly.
And it could be either all of them or just a few of them. And maybe Susan, let's just actually finish with you what we were talking about before I could ask you the next question. Yeah. Should I remind you? Okay. We were at the gap where we are, but before that you had finished on that, and now we were talking about the controlling of your child, controlling the head.
Okay. So it's something that you will have to develop, like even a timetable or just a reminder that when I'm holding my baby like this, I need to put them in this posture. When just things that you have to do. This is why I always encourage parents to, when they get to the occupational therapist, they should engage the occupational therapist, and so that they can learn more about what they are supposed to do at home, because the occupational therapist is with the child for 1 hour or even less, but you have the child for other 23 hours. So it is up to the parent to learn more about this. And for the occupational therapist, I would tell them to train the children, train the parents more about home remedies, more about how they're supposed to be handling their children, other than just doing their thing, and once the session is over, and the parent goes. If it is the parent, yes, it is hard to see your child going through therapy. Sometimes some cry very much and even lose the concentration. But I tell the parents, try as much as you can to get to get concentration for what is going on, so that you can do the same. Buy some devices that you would use at home, the rollers, the wedges and all, so that you can have this child positioned well when at home. And because there's a way you can position that child until the occupational therapy is not helping, you are undoing what the therapist did. So it is good for people to get to learn this. And also, if the government would set up institutions or a curriculum, a short curriculum, maybe part-time for parents to go and learn occupational therapy other than having a full-time. Like when I asked about where I can go for training, I was told it's a full-time course. Well, for me, I had an opportunity to learn from a therapist, and I've been able to handle my child through therapy quite well without having the more intervention with other therapists, because as I said, therapy is quite pricey. If you can't afford through, then you have to find a way to help your own child. So I think we should have part-time institutions where we can go for these courses. Yeah.
And Doc, just give us a few. First, tell us the complications that can come once a child with cerebral palsy is not taken good care of, and finish with a few tips that we can prevent cerebral palsy before pregnancy, during pregnancy, and even after delivery.
Well, yeah, complications are things like epilepsy. If it's not managed well, then it keeps causing more damage to the brain. So medications are very important. Other complications are abuse of the child, neglect, because some families may try and hide the child away, not take good care of the child, tie the child at home, and things like that, not expose them. So those are issues which could come up. Prevention, good antenatal care, delivery and postnatal care, such that we look out for any infections which could predispose to cerebral palsy, good delivery services, and look out for jaundice and other infections like meningitis or encephalitis in the baby, head injury. And so those are the ways we can try and prevent cerebral palsy.
Okay, and finally, Susan, a message to mothers out there with children with cerebral palsy. Some may be facing a lot of stigma, others a lot of support. What is your one message to them?
I would tell the parents that your child is a baby or is a child before she become a child with special needs. So treat them like any other child, love them, take care of them. Because if you don't, again, that child might also be not even a burden to themselves. That child doesn't know they are different. You're the one who knows the difference between them and others. So if you don't take care of them, it will be possibly a burden to you. If you don't take your child for occupational therapy and they get contractures and their muscles shorten, it will be hard when they grow up and you have to carry them around. So the care that you take for that child will determine how you will live with that child. Again, when you get that child with cerebral palsy, it's your opportunity to tell others about it. It's a chance you've been given to create awareness. Don't hide that child in the house. Don't feel like that child does not belong to the society. The way you will show others is how they will carry that child.
Yeah. And that's all the time we had for the show. Dr. Edward Sang, thank you so much for coming. Thank you so much. Susan, we can't thank you enough. Thank you so much, and also for bringing this beautiful princess to us. We do appreciate. That's all the time, and thank you all for watching. My Doctor Show continues tomorrow. My name is Purity Museo. Remember, you can always download the previous episodes from our YouTube channel. Simply go to Ebru TV Kenya or Purity Museo and look for the episode of your choice. Do enjoy your time. Goodbye.